Hello. In this chapter, we'll be talking about drugs for gastric ulcers and reflux. As an objective for this class, we will be explaining how different classes of drugs are used to treat peptic ulcer disease as well as gastroesophageal reflux disease or GERD. We're going to talk about drug names, possible side effects and adverse effects of these drugs, describe what to do before and after giving these medications, explain what to do to your patients, what not to do, and when to call the doctor, and of course, describe lifespan considerations for peptic ulcer disease as well as GERD medication. Just a quick physiology and pathophysiology. We know that your upper GI system is responsible for taking in the food and moving it into the stomach. We know that digestion starts in the mouth, where chewing begins, and different enzymes are mixed into the food. And food is digested and converted into a form that the body can use. Gastric glands secrete digestive enzymes and gastric juices. And the stomach churns and mixes the food. It secretes the mucus to coat it, the stomach, and protect it from the stomach acid. So it has its own coating agent. So because your stomach can be very, very acidic, especially during digestion, it releases hydrochloric acid for breaking down the food that you're taking in. But in order, since it's an acid, it can damage your stomach mucosa. Therefore, your stomach itself releases its own mucus coating so that the acid does not damage it. So your intestinal tract relies on buffers. When we talk about buffers, it's like enzymes or fluid or secretions that prevents it from becoming too acidic. So we talk about peptic ulcer disease. We have your different ulcers, different areas where ulcers can originate from. It could be gastric ulcers, duodenal ulcers, which is in your duodenum, and esophageal ulcers, which is also located in your lower part of the esophagus. Usual causes for these ulcers is an infection called H. pylori or Helicobacter pylori, which is a bacteria. It could also be related to lifestyle, such as excessive stress or diet that's high in acid, such as spicy food, coffee, and of course, excess acid intake. Your gastric mucosa, try to resist the damage, like what we said, that it releases its own mucus coating to prevent it from becoming damaged. However, if there is excessive secretion of acid in the stomach, then ulcers can develop. These are the locations of ulcers that we talked about earlier. Esophageal ulcers is in the lower part of your esophagus. Gastric ulcers located in your stomach itself, and duodenal ulcers is towards the entrance of your small intestine from your stomach. So a quick pathophysiology of ulcers. So once ulcers develop and it's not treated, it can extend to, it can get more in-depth towards your stomach lining, which can damage vessels. So once the blood vessel gets damaged, blood will leak into your stomach or even outside your stomach. So life-threatening condition can happen because of that. You can have a bleeding ulcer in your stomach or peritonitis related to a bleeding ulcer outside your stomach area. So gastrointestinal ulcers, these are open sores that develop on the duodenum or in any other areas. Symptoms of ulcers can be burning, gnawing pain, which can caused by the stomach acid in your that is being released. Vomiting, dark stool could be towards the end of this condition because that means that there's already a bleed in your stomach. Weight loss and chest pain. Antibiotics are important in treating peptic ulcer disease, and treatment definitely involves both drugs and lifestyle modification. When it comes to gastric ulcers, you have to make sure you um, prevent taking non-steroidal anti-inflammatory drugs, which is your NSAIDs, could be your ibuprofen or Motrin, Aleve or naproxen and whatnot. Because as your as your ulcers continue to happen and not treated or not healed, serious complication may occur. So once a bleed occurs in your stomach, accumulation of blood will happen in your stomach area, and mixed with acid, it will turn black. That's why you have dark stools or you have coffee ground emesis. But once it gets perforated continuously out of your stomach, bleed can occur. It can will have it can lead to shock or peritonitis. So when we talk about GERD, gastroesophageal reflux disease, it means that um, your lower esophageal sphincter is either not working or it's getting weak. What happens here is that your stomach contents, which includes acid, can get regurgitated up from your stomach up to your esophagus. That's causing the burning sensation. Um, Once it goes up to your esophagus, since it doesn't have enough coating, just like what your stomach lining usually has, it can cause inflammation. And it unfortunately, once this begins, patient might require lifelong treatment. So this condition may also create ulcers in your esophagus because of the lack of protection of the esophagus from the acid contents of your stomach. Let's just do a quick understanding of what would happen if your ulcers completely becomes infected and then it perforates and it starts bleeding out. You will have also symptoms of advanced bleeding ulcer, which could be abdominal pain. It could be it can range from dark stool to bright red stools, coffee ground emesis, and those symptoms are life-threatening, so you have to call the doctor right away. So this is how acid reflux happens. So this is your esophageal sphincter. This is the one that becomes weak. This usually closes every time you eat, and that's why it prevents acid content from expulsion. However, with GERD, since your sphincter muscle is weak, acid contents goes up. Before giving medications for this, you have to have a complete list of drugs that the patient is currently taking, baseline vital signs and weight, bowel habits, appearance of the stool, any vomiting or bleeding, assess for bleeding or vomiting or any kind of reflux before giving this medication to know that you're really treating the right condition. Also assess for abdominal distension and pain. After giving this medication, you have to check their vital signs and again their weight, monitor for abnormal heartbeats or heart rhythms, and track your bowel movements or patient's bowel movements for frequency and consistency. You have to teach your patient to take this exactly as prescribed. Do not take a double dose. Give them enough fluid and fiber-containing food to prevent constipation. Avoid alcohol, aspirin products, and definitely NSAIDs or any kind of irritating foods such as coffee, chocolate, spicy food. So these are the types of drugs that we'll be talking about in this class. You have your histamine H2 blockers, which decreases the secretion of gastric acid. Proton pump inhibitors, which block the secretion of gastric acid. Cytoprotective drugs, which forms a thick coating on open sores. Antacids, antibiotics for H. pylori, and pro-motility drugs. When we talked about histamine or H2 blockers, this is your TDINs. These are the medications that start or that ends with E, I, N, I. Sorry. These are the medications that start or that ends with E, I, N, I. Sorry. These are the medications that start or that ends with E, I, N, I. Sorry. These are the medications that start or that ends with E, I, N, I. Sorry. These are the medications that start or that ends with E, I, N, I. Sorry. So these are your tidines, your famotidine, your ranitidine, your zinatidine. Um, the intention of this medication is to decrease secretions of gastric acid and prevention of GERD or relief of GERD symptoms. It also helps to heal and prevent ulcers because if there is lack of acid that's being produced, less irritation is going to happen in your stomach. Therefore, it allows your body to heal the ulcers. Side effects can include confusion, dizziness, drowsiness, headache, altered taste, nausea, vomiting, and constipation. Other adverse effects can include dysrhythmias, decreased white blood cell count and neutropenia, agranulocytosis, and aplastic anemia. Please note that if you are giving your patient ranitidine or Zantac, that's the brand name. So this is the generic name. Ranitidine. Sorry. Or Zantac, once a day, you have to give this medication in the evening because it allows um, your patient to have a prolonged effect. So usually a large amount of acid is being produced during the day. But if this is twice a day, you have to give this 30 minutes before each meal. Um, Also know that this can cause discoloration of your tongue and also black stool. So you have to educate your patient. Just because they're having black stool does not mean that they're having a GI bleed. It could be just a sign of their medication, so you need to review their medications with them. Before giving this medication, you have to know their baseline level of consciousness. Give this with meals to prolong therapeutic effects. If it's twice a day, if it's given intravenously, you have to check the site every 2 to 4 hours. After giving this drug, make sure that their colite is easily reached because of the possibility of drowsiness and lightheadedness with this drug. Watch for side effects. Teach your patient that if this medication is more than 2 weeks and there's still no relief, to contact their prescriber. Avoid smoking and operating any heavy machineries while on this medication. For pregnancy and lactation, consult the doctor before taking this medication and avoid this while breastfeeding because it can get excreted in breast milk. For older adults, they have increased dizziness and constipation and confusion rather. Avoid falls because again, this can cause drowsiness or dizziness. Make sure you have handrails on the stairs to protect them, and avoid drinking or using heavy machineries while on this medication. So now we'll talk about proton pump inhibitors. So proton pump inhibitors or PPIs, these are your prazoles. So their ending is PRAZOLE. So it could be omeprazole, pantoprazole, lansoprazole, esomeprazole. So these are they completely block the production of stomach acid using this proton pump. So they have this pump, and this proton pump inhibitors are the one that blocks the production on that pump to decrease the acid level in the stomach. This is the most powerful drugs for treating peptic ulcer disease or constipation. You have to use sometimes it is used in combination with H2 blockers or as a replacement for H2 blockers if they are ineffective. The intended response is to decrease gastric acid secretion and acid reflux, which heals the ulcer. Side effects includes diarrhea, constipation, belching, gas, abdominal pain, and headache. Please note that long-term use of this medication can lead to infection because know that gastric acid does not just dissolve food, it also kills bacteria that enters your stomach. So if there's less acid to kill the bacteria, there's more bacteria that can occur in your stomach, which can lead to infection. And also it can lead to anemia because there's a specific factor in that the stomach is trying to create, and this factor, if you are blocking the production of acid, the pumps that produce acid, it can also alter the production of this particular factor, that leads to anemia. So before giving this medication, try to give them before meals, preferably in the morning. Check the IV sites for patency or signs of infection if this is given intravenously. The most common drug that's given intravenously is your Protonix or pantoprazole. Check after giving this drug for black or tarry stools. You have to teach your patient to take this exactly as prescribed and to report any black stools that can occur. Report diarrhea, abdominal pain, and persistent headaches as well. Last one consideration, for pregnancy and lactation, do not take omeprazole, pantoprazole, and rabeprazole for pregnant women, and this is not recommended during breastfeeding, so the doctor may need to explore another alternative. For older adults, again, we have more side effects. This can decrease absorption of calcium, which is at greater risk for hip fracture. And this can also decrease the absorption of vitamin B12, like what I talked to you about the factor. The intrinsic factor is the one that absorbs the vitamin B12, and vitamin B12 is responsible for helping production of a specific type of red blood cells. But if this is not absorbed enough, the vitamin B12 will not be absorbed, and the possibility of aplastic anemia is what they call can occur. Now we talk about antacids. So antacids, they neutralize gastric acids. That's why antacids. They relieve heartburn and indigestion. They decrease symptoms of GERD, decrease ulcer pain, and allow ulcers to heal. However, side effects of this medication, particularly with calcium and aluminum type of antacids, is constipation, and with diarrhea, magnesium salt is responsible for it. You have to make sure that antacids are given 1 hour after or 2 hours before any drugs, because this can alter the absorption of other drugs if you take it with them. Antacids, again, you have to contact your doctor if they have been taking this antacids for over 2 weeks, because this is not a consistent drug. This is just as needed basis. Do not take this with aluminum hydroxide or calcium antacids within 1 to 2 hours of other drug. Talk about side effects of post diarrhea, because patients will not love that. And then antacids should be avoided if there are any signs of appendicitis or inflamed bowel that could be present. Lifespan consideration. Do not give this drug to a pediatric patient unless otherwise directed by a doctor. Pregnancy and lactation. This is generally safe. Long-term use of antacid may have negative effects on the fetus, though. Older adults, avoid aluminum-containing drugs with bone problems such as osteoporosis and Alzheimer's disease. Now we talk about cytoprotective. So cytoprotective means cell protection. This works by coating some part of the GI mucosa, which reduces the exposure of the ulcers to stomach acid. And the medication that's included in this drug is your sucralfate, carafate, and your bismuth. So sucralfate reacts with stomach acid and form a thick coating that covers the surface of an ulcer. So if this is your stomach and there's an ulcer here, cytoprotective drugs coats it and protects it from stomach acid. Bismuth is also coats the stomach and intestines and protecting the mucosa from stomach acids. So intended response is to protect and prevent tissue damage, and ulcer gets healed. Side effects is definitely constipation, possibly dizziness and dry mouth, as well as rashes. Take this drug exactly as prescribed by the doctor. Increase the fluid intake and dietary fiber because it can cause constipation. Exercise regularly to promote motility. And lifespan consideration for pregnancy and lactation, sucralfate is safe. So we talk about promotility drugs, which is technically your Reglan or metoclopramide. This is given 30 minutes before or before meals for 4 to 12 weeks, depending upon the doctor's order. Um, Other drugs that can be used for ulcers caused by H. pylori is definitely antibiotics. This is usually H. pylori is usually treated by combination of two antibiotics as well as an H2 blocker, PPI, or a cytoprotective drug. So example of this is your Pylera, if you have ever heard of the term Pylera. Pylera is a combination of metronidazole, which is your flagyl, and tetracycline, as well as bismuth. It's a drug that patients take to between 7 to 14 days, depending upon the doctor's order. This helps to treat or kill the bacteria that causes ulcers, peptic ulcer disease caused by H. pylori.